Well, as you've just heard, Africa is now reporting over 10 million COVID-19 cases. The African Centers for Disease Control and Prevention announced the death toll on the continent now at 223,000. Majority of the deaths reported in South Africa, which accounted for 35% of the total. Well, for a little bit more on this, we're now joined via Zoom by Professor Adrian Puren, who's the Acting Executive Director of the National Institute for Communicable Diseases. Thanks very much indeed for joining us, Prof. Welcome to the program.
Good evening, Peter, and good evening to your viewers. Thank you very much for the opportunity.
So, 10 million cases COVID-19. On the face of it, when we think about an Africa population of about 1.2, 1.3 billion, it seems as if our continent has done okay, actually, when you compare to what's happened in other parts of the globe.
Well, it's an important, I guess, figure. But I think, again, Peter, we just need to keep in mind that when we're doing testing, that the numbers are probably larger than that. In other words, I think that even though we say that there are 3 million PCR confirmed cases in South Africa, PCR plus antigen tests that have been completed, the actual numbers are probably much, much higher than that. And similarly, I think with regard to the reporting of deaths, again, even within South Africa, that they are probably underestimates of what's actually happened in South Africa. And that's primarily because of our data collection systems that are sometimes fairly fragile and weak. But I think there have been great efforts and great strides to improve our reporting on the continent.
Let's talk a little bit about the journey to 10 million. We got COVID-19 a little after the rest of the world, but when it did come, it came with a vengeance. But still, bearing in mind what you've just said, it does seem that we've gone through the waves without getting to such figures that our health systems collapsed.
Yes, again, I think that's important. I think at least in this particular resurgence, the fourth resurgence, at least in South Africa, I think our health systems have certainly kept up, if you like. However, the previous wave, certainly there was a great deal of strain. So I think we've been fortunate in the sense that with this particular current variant, we do see and have seen large numbers of infections. However, this has not translated, at least in South Africa and in various places, in terms of the overwhelming health systems. And I think that that's really going to be critical. Whether that's going to happen in the future, I think is difficult to predict. However, I think the clip where John Ngengasong, the head of Africa CDC, has indicated that the result of greater exposures, natural infections, has probably provided a certain degree of protection against the current variant and may be so for future variants as well. So that can be really critical in the sense that we will have large numbers of infections, but in fact, in terms of the outcomes with regard to severe disease, hospitalizations and deaths, the outcome may be much better than what we've seen in previous resurgences. But again, I think it'd be just to interpret that with caution.
All right, so we might not know exactly the number of people infected. It could be much, much more than the 10 million that's reported. But what we do know for sure is that we're not doing very well in terms of vaccinations. And I guess that this really is a pivotal thing in terms of how the journey of COVID-19 continues on the continent compared to the rest of the world.
Absolutely. So, as we've spoken about equity, and that's been an important consideration, continues to be an important consideration. However, one of the major problems that we're currently therefore facing is not just a matter about equity and therefore the low coverage within various African countries. South Africa's only achieved a moderate success of about 40% in terms of vaccines, and therefore I think we have large numbers of vaccines available for us to actually now add on boosters, for example. And I think some of the other African countries are in a similar position where they have vaccine, but the time to expiry is going to come up very quickly. And if that's not utilized, those vaccines may well go to waste. So it's really critical that as a continent and specific countries, how do we try and ensure that we overcome the specific problems that we face within each of our particular countries, whether that be around access to vaccines, the logistics around that, versus, for example, vaccine hesitancy and people just really not participating in vaccine programs and seeing the relevance of these particular programs. I think that's going to be really important.
Yeah, the Director General, Tedros Ghebreyesus, is very concerned that, we haven't reached the targets that were set for the end of last year. And he looked at July, August this year as a next sort of marker. It looks like we are probably only going to start to get to the required numbers 2024. And I just wonder what that might mean in terms of our journey dealing with illness and the threat of new variants.
Yeah, so that does raise that specter. I think we're enthusiastic in South Africa about talking about endemic control and so forth. But I think if you're looking more broadly than that, in terms of having a virus that is in endemic circulation, I think there's still much work to be done, given the levels of vaccine coverage, given the fact that we are unable to predict what's going to happen with this particular virus, and given that if we do not achieve high rates of vaccine coverage, the virus is going to be in circulation for a while, and therefore the implications are that we will see continued outbreaks, perhaps not to the same extent possibly, if we certainly improve our vaccine coverage, but we can certainly see variants that may arise which may well be more severe than what we currently are experiencing. So we've got a way to go. I know that we would be keen, especially, I suppose, around the wearing of masks and physical isolation and ventilation. These are unfortunately still going to be key. And I know you and I have spoken about this often enough, but unfortunately it still remains with us, given the fact that we're not achieving those levels of vaccine coverage that are really required to prevent the formation of variants and being able to control this particular pandemic.
South Africa is very good at looking at new markers and looking at variants as they come through. Not all the countries on the continent sadly have similar ability, but they have the ability to spread new variants of COVID-19. How do we manage this? Because it's all very well for us here in South Africa to do all this great work, but if next door the same level of detection and work is not being done, we could end up importing these variants for some time to come.
That is a possibility, but I think the Africa CDC is a good example of what's actually happened within the continent in terms of trying to coordinate activities. And I think when you look at the role which it has played with countries, I think in terms of trying to provide access to diagnostics or access to treatments, I think they really have played a significant role, obviously in collaboration with other partners as well. And that includes, for example, South Africa, certainly, as you know, in terms of identifying variants, has really played a pivotal role in that. And some of that support really comes through organizations such as Africa CDC, not only for our own sequencing within country, but also to provide access to countries outside of South Africa. And there are other African centers that do play a similar role. It's really trying, therefore, to see how we can expand our genetic or molecular networks in order to identify variants as early as possible. So I think there's been some significant move in that particular direction, and therefore I hope that momentum continues to address the really concerns that you have raised.
I know that this is a moving target in terms of getting intelligence and understanding of this variants and this coronavirus, but I'm just wondering if we know enough now in terms of the emergence of variants. If we are assuming that if we get herd immunity, we get a significant number of people vaccinated, that we are less likely to see new variants coming along. Have we started to almost have proof of that? Because I know that it's a running theory, but are we starting to get enough data maybe to suggest that if we carry on vaccinating, we're going to slow down the rate of emergence of new variants?
That's a difficult question, I think. I think certainly, of course, with the increase in coverage, you certainly will, by dint of having that coverage, prevent further transmission. But there may well be variants that may arise, and I think that is the concern, is that do we have the necessary tools? And I think there is some evidence or some models that people are currently proposing to say what is the likely projection, the likely targets, the likely mutations that will occur, and the implications of that. But I think it has to always be in conjunction, I think, with the epidemiological settings and outcomes. I think when Omicron arose, I think people feared the worst in the sense of not just numbers of cases, but also in terms of the specific outcomes with regard to severity of disease and mortality. However, it's certainly shown to be somewhat different. So I think we're still learning. I think there's still much to learn about what will actually happen. I think also the development of next generation vaccines, I think will really be important as well. I think there's much discussion around a so-called universal coronavirus vaccine in order to deal with these particular mutations, or specific variant-based vaccines that will really be critical. So I think there's much to inform about how our current approaches should be adopted. And that includes interventions such as the use of monoclonal antibodies and, for example, particular drugs that we could certainly introduce as well. So I think there'll be great advances along those lines to actually manage the various scenarios that may arise. Yes.
All right, we've run out of time, but if you could answer this question sort of quickly. Based on what we know now, based on the journey we've taken so far, we're at 10 million. What do you see as key milestones and key points, maybe in the next year or so, for the continent in terms of COVID-19? What are you looking out for?
Yes, so I think from my perspective, and this is based on the various discussions that we're having, I think it's not always the numbers of cases. I think we've got to move away from that. And I think it's really focusing on the hospital-based numbers and cases. I think that's where our focus should be. Our diagnostics should be focused, our treatments, and then also focusing around the interventions. What are the key interventions I think that we need to have in place? We've got an array of possible interventions, but what are the ones that will really work for us in terms of, for example, the wearing of masks, possibly ventilation plus vaccines? These are probably the so-called key interventions in terms of, and therefore looking at those hospital numbers to tell us where we are actually with this particular outbreak.
Professor Adrian Puren, thank you so much indeed for joining us. Always great talking to you.
Thank you very much for the opportunity.
Thank you.